please take our greetings to Malala when you see her in Birmingham. We come almost full circle with this outstanding conference. I don't put a sad note on that, no question. But I'm full of joy now to introduce Jamie Lachman to you. He's a research officer at the University of Oxford Department of Social Policy and Intervention. And he's also the executive director and founder of Clowns Without Borders, South Africa. And he's the co-founder of the Parenting for Lifelong Health initiative. And I think with all he does one thing. He's dedicated to promoting our human capacity, and that connects to the last speech, for peace and laughter. Jamie.
Thank you very much. It's a thrill to be here today and for the last couple days. I have to say that when I was asked to speak at the conference, I was like, well, I always say yes, because it's like one of the rules of improv. But I had no idea I was going to be asked to have the last words, or the next to last words. And I also had no idea that I was going to also be asked to play some music, too. So just because I'm willing to fail spectacularly, I hope that you also will join me in that adventure when we get to sing a little song together as well. But first, I will say a few words. So I've been asked to also kind of sum up things with looking at the context, agency, and skills, and wear these two hats of both presenting something new and also bringing together a couple of threads. And just as a background, I was fortunate to have a very loving and involved family. In fact, I was also raised by my grandparents as well as my parents. And you know, I like to say that there are, as it has been said before, there's no such thing as bad children. We say this a lot in parenting programs. And actually, there's no such thing as a bad parent. Sometimes there's not as effective parenting. And here's an example of me in timeout. And it's interesting that my sister's also there in timeout. So I'm not really sure exactly what we were doing wrong, but we definitely shouldn't have been right next to each other, because I'm sure something else happened during the 5 minutes of timeout on the stairs. But what I'd like to talk about is the ABCs, as I like to think of positive parenting, of really making sure that we are able to provide parents with the skills and capacities to have strong attachment through responsivity and sensitivity to their children, and also being able to manage difficult behaviors through positive reinforcement and limit setting and effective discipline, and also to be engaging in cognitive stimulation. And I think that you can actually find a way through play to address all three of these ABCs. So that even when we are monitoring and managing behavior, we can do that through a very playful and engaged way. So we know from research that healthy parenting has a very strong role in the effect on early development of children through improving child developmental health, reducing risk of child maltreatment, and promoting child well-being and thriving that prevents later problems in life, both in adolescence and further on in life. And there are lots of parenting programs out there. There are very many that are from both high-income countries and in low and middle-income countries. And what we found in our research and our systematic reviews and meta-analyses is that the ones that work train parents in skills and help them learn new behaviors of how to interact with their children. And that knowledge is not enough. And so a lot of programs that are very didactic don't really get the same effect as a program that really helps parents practice those skills, both within a session and also at home with their children. And we have parenting programs that can be individual, they can be group-based, they can be with parents and children together, but they can also be just a parent by themselves working as a group. They can be for mothers and fathers and caregivers. But the most important thing is that there's opportunities to practice. We also know a lot of evidence that parenting programs are effective at many different outcomes, improving child development, reducing violence against children, and even reducing depression and maternal mental health problems. And there's a lot of evidence that is coming out from both high-income countries, but emerging evidence that's coming from low and middle-income countries. And we've now identified 65 rigorous trials of parenting programs in low and middle-income countries that are investigating the evidence of effectiveness. And we do know that the parenting programs are best delivered as an early intervention to prevent later problems, and that transported parenting programs are equally as effective as homegrown programs. And also that parenting programs can be effective for both poor families, single mothers, depressed parents, migrants, ethnic minorities. And what's interesting is that parenting programs in particular can be effective across different age groups, so that they're equally effective at age 2 as they might be for older children. And this is really important because even though we know it's so important to invest in early childhood development, for those who don't get that opportunity, it's not too late, and that we can still have an impact on their well-being later on in life. So there's also this growing demand for parenting programs in low and middle income countries through things like the Inspire Network for Ending Violence Against Children. But we also have a lot of barriers to scale up, and I was really fortunate to be part of the Scale Up group for a bit of it. And some of the most important barriers are that there's a lot of established evidence-based programs are too costly to be delivered or too complex to be delivered. And also, there's limited capacity to take these programs to scale. And so there is a bottleneck of evidence, but not reach. This has led us to think of 4 core criteria for taking parenting programs for scale. And I'm just going to briefly touch upon each one of these. The first is that it's really important that parenting programs are effective, that we know that they do more good than harm, and we can identify that it's the program that's having the effect and not some other confounding factor. It's also very important that we know who it does well for and why does it not work for some people, that specificity that we were learning about earlier, and what are the essential components to these parenting programs. It's also really important that parenting programs are economic, that they avoid wasting time and human resources and money, and that they are designed so they fit within budget constraints and are cost effective. It's also really important that we recognize context and culture and really harness the positive attributes from cultures to really empower parents as active agents in their own change, that the programs are collaborative and use parents as experts and not as vessels for changing things in their children's lives. And lastly, the parenting programs need to be scalable. They need to be integrated within existing services, replicable and sustainable. So I was very fortunate to be part of an initiative that has been working with UNICEF and the World Health Organization called Parenting for Lifelong Health. And we tried to apply these criteria to the work that we've been doing. We started off in South Africa, and over the last 3-4 years, we've actually expanded to over 22 countries with looking at almost 400,000 people to be beneficiaries, mostly through USAID and UNICEF initiatives. Now, in order to make this work, it's really important that these programs were integrated within existing service delivery systems. So like in South Africa, we're working with the Department of Social Development to scale up the program in all 9 provinces through the social workforce. Whereas in Thailand, we're working through the Ministry of Public Health and their health promotion offices. And in the Philippines, it's with a conditional cash transfer for low-income families. And then in order for that to work, we really have to adapt the program for different cultures. And you can see our model of building a supportive house that starts with one-on-one time with your child through child-led play, gets adapted to look at houses in different cultures and contexts. And even the illustrated stories, and I like this story because it's a story of a father working with bricks with his child, and we saw this with Paul's presentation. And in the previous story, he interfered too much and the child walked away. Here he's learning how to use descriptive commenting to play with his child and get his child to invite him into the action of play. And here we have it for Macedonian families, and here it is for Filipino families. And here you can see the same story in helping parents identify positive skills for Thai families. And the parenting programs really, they look very similar in different contexts. And here we have both Malaysia and Lesotho. They're sitting on the ground learning together, one outside, one indoors. And also the way that parents respond to the programs tend to be very similar across different contexts. And I have 4 different quotes that are very similar, but they come from different countries. And what we're beginning to see is that the evidence, when you do that important step of culturally adapting and piloting a program, then the program will have an effect no matter what kind of context, as long as it's addressing the parents at the level of the parents. So our work was really focused on testing, and actually first tests and pilots and RCTs, it didn't work, or it wasn't scalable. And so now we're looking at optimizing the program for scalability using more innovative research methods like using factorial experiments. But we have some evidence for effectiveness of improving positive parenting, sensitivity, responsivity, and also reducing violence against children, child behavior problems. And here's some effects that we've seen at 1 year where we have sustained effects at reducing violence against children. But there are some considerations that we have to still think about, and I think this addresses for everyone looking at research and implementation of parenting programs. And one of that is to reduce cost and complexity of our programs, to make sure that they're adaptable for specific populations, to increase the capacity of implementing agencies, and to develop systems that we can monitor and sustain the delivery at scale. But now I'd like to get back to some basics. And so we have our ABCs. The first one, attachment, really focusing on love and support. Behavior management, looking at structure and consistency. And cognitive stimulation through play and fun. What I've done now is figured out a way to put this all to song. But I need your help to be able to close this together, okay? Because I learned how to do this from a singer-songwriter named Pete Seeger, and he never sang by himself, and I don't really feel like I have the voice that can do that, so I really want you to join me in this. So I'm just gonna grab my banjo, and hopefully all the sound stuff works. Can you hear that? All right, great. So first, it's really important that we show our love and support for children. And the song that goes along with this is Swing Low, Sweet Chariot, which is an old spiritual song, but I've changed some of the words. So it is a little bit more about the role that we have with our children. Swing low, sweet babe of mine, Mama's gonna carry you home. Swing low, sweet babe of mine, Papa's gonna carry you home. You know the brain, it develops from the moment of birth. Mama's gonna carry you home. So read to your children for what it's worth. Papa's gonna carry you home. Sing low, swing low, sweet babe of mine, Mama's gonna carry you home. Swing low, sweet babe of mine, Mama's gonna carry you home. So we got the attachment, and it sounds really beautiful. You guys sing really well. But we got to get a little structure and a little behavior management now, right? And there's a song that goes along with this too. It's a little bit more like marching. And it goes to when the saints go marching in. Oh, when the mamas, oh, when the papas, oh, when the mamas and the papas, they play. Oh, how I want to be in that number when the mamas and the papas, they play. Consistent rules, daily routines, they make a child feel secure and safe. Like Lego bricks building a structure so they know how to behave. Oh, when the mamas, oh, and the papas, oh, when the mamas and the papas, they play. Oh, how I want to be in that number when the mamas and the papas, they play. Great, so we got good structure, we've got some love, but without a sense of fun and play, it just doesn't work for kids. And so we need to really get some singing and some dancing in here. So the last song, which is a little bit less familiar to people, goes a little bit like this. We're gonna sing, sing, sing. We're gonna dance, dance, dance. We're gonna sing, we're gonna dance all day with you. Learning through play is the way, gotta do it every day. We're gonna sing, we're gonna dance all day with you. We're gonna sing, sing, sing. We're gonna dance, dance, dance. We're gonna sing, we're gonna dance all day with you. Learning through play is the way, gotta do it every day. We're gonna sing, we're gonna dance all day with you. One more time, we're gonna sing, sing, sing. We're gonna dance, dance, dance. We're gonna sing, we're gonna dance all day with you. Learning through play is the way, gotta do it every day. We're gonna sing, we're gonna dance all day with you. Thank you very much. And that's the ABCs of positive parenting. Oh, okay, we're gonna have to start over that thing later. John.
Thank you very much for the 2019 Idea Conference. Let me hand it back to Jamie.
Okay, so you know parenting isn't easy, right? And so we're going to give you a difficult task as your last fun, playful task. And that is the ABCs don't work in isolation from each other. You actually have to do them all at the same time. And the magic of these songs is that you can actually sing them together and it works. So what I want you to do at this moment is think about yourself and think of what kind of mood or person you feel that you're in. And if you're someone who needs a little love and care, you might want to sing Swing Low, Sweet Babe of Mine. And if you're someone who is like a little bit out of control and needs a bit of structure in your life, oh, the mamas and the papas, okay? And if you're someone who just wants to let loose and go wild, you can sing and you can dance, right? So I was going to divide it up, but there's only 3 songs and there are 4 sides of you, so it doesn't work. I couldn't do the math right. So you really got to know that the person next to you might be singing something completely different from you, all right? You actually learn something about that person that maybe they haven't told you yet. But what we're going to do is we're going to build it, okay? So we're going to do first the loving kindness and touch. So those of you who need a little bit of love in your life, swing low, sweet babe of mine. Mama's gonna carry you home. Swing low, sweet babe of mine. Papa's gonna carry. Just keep on singing that over again. Sing low, sweet babe of mine. Mama's gonna carry you home. Swing low, sweet babe of mine. Mama, ready for the mamas? Keep on singing that. When the mamas and then the papas, oh, when the mamas and the papas they play, oh, how I want to be in that number. When the mamas and the papas they play, oh, when the mamas, sweet babe of mine, mamas and the papas they play, how I want to be in that number. When the mamas, ready for the singing? We're gonna sing, sing, sing. We're gonna dance, dance, dance. We're gonna sing, we're gonna dance all day with you. Learning through play is the way, gotta do it every day. We're gonna sing, we keep on singing, maybe stand up. We're gonna sing, sing, sing. We're gonna dance, dance, dance.